Okay, so we are going to the next part, section B. They said that's short basic questions. Like when you tackle the first 25 questions and you are sure of, let's say, 20 marks, it just comes to 20. Like that year 2020, you notice that that year was just uh, it was also 25 marks for section B. There's individuals who are obese and who stand for long periods are at risk of developing what we call varicose veins. What are varicose veins? Two, that's B, signs and symptoms of the disease. C, how can they be managed? D, post-operative nursing care. So what are post-operative? That's past, right? After operation, because that's one of the principal management of this condition is done by doing sclerotherapy, laser treatment, operation, phlebotomy, and all of that. So they're asking us what are varicose veins. 1 mark. You state the signs and symptoms of varicose veins. So what are varicose veins? Varicose veins are enlarged, swollen, twisted veins, often appearing blue or dark purple, mostly found where at the extremities. It's found at the extremities, just below your kneecap now, behind your leg like that, behind. Most of the time, many people develop it at that level, behind. They call it at these muscles behind your kneecap, right, going down to this tibia and fibula bone down like that at the ankle of the leg, behind that muscle at that region like that. That's where the veins mostly appear. Most commonly they appear, though they can appear in any part of the body, even in the neck it can appear, in the hands it can appear, but that's the most commonest area where it does appear. And we are saying that it is mostly common in adults. It's mostly common in adults. Right, so we are saying, what is varicose veins? Varicose veins are enlarged, swollen, twisted veins, often appearing blue or dark purple at extremities. Commonly, it affects adults. You get your 1 mark free of charge. So, if you are told, you give like the causes or the risk factors of the condition. The risk factors could be, right, it happens superficially, right, and we are saying obesity, hypertension, right, and also when the valves of the veins get weakened or get damaged, the blood can tend to accumulate in that area. And we are saying that most of the time the varicose vein occur as a result of a reduced flow of blood back to the heart. So when blood flows is limited, or when the valves of the vein or the veins closes, blood is bound to retain in that area, and when blood retains to that area, it can result to varicose veins. And so they're asking us the signs and symptoms. What are the signs and symptoms of varicose veins? They're asking us what are the signs and the symptoms of varicose veins. You get some of the signs are, most of the time those who experience that they experience burning, like burning something with pain. It pains them at times. It discomforts them. It brings pain. It can result to muscle cramps in the legs, right? It results to pain even during sitting, and even standing for long. It results to pain at the region where the twisted vein has been found, especially when standing for long, right? And we are saying that it become burning at times. It itches, it results to muscle cramps and all of that, and aches. You have heavy feeling. You just feel heavy at the region where the twisted or the swollen vein is found. So those are the signs and symptoms. They have given us how many marks there? They have given us around 2 marks, so you don't need to write much. At least if you can give 4 or 5 signs and symptoms, that would be good. We have said it results to burning sensation at the legs, especially, yeah, at the legs, aches, plus pains, still at the legs, a feeling of heaviness at those areas, a discoloration of the veins at those areas, and itchy or muscle cramp at those areas. So that is what we are giving a sense of symptoms of varicose veins. We are saying, how can varicose veins be managed? How can it be managed when it has worsened like that? How do we manage varicose veins? They have given us two marks. How do we manage it surgically? You can manage it surgically. You can manage it, and when we are talking about surgically, we are talking about a condition called phlebotomy, removal. At time, an incision is cut done to remove the blood that is found in those veins, or the veins can be removed. Right? They can also do what is known as sclerotherapy, or laser treatment. All of them, they are surgical means of managing the condition, or we can do what is known as physiotherapy, right? A massage of that particular area, a massage, thorough massage of that area. But now the massage cannot resolve the destruction of the valves that has retained the blood in those areas. So you take note of that. So most often then the best way of managing it is a surgical means, which could be managed surgically with procedures like sclerotherapy, procedures like laser treatment, right? Laser treatment. When we are talking then surgical management, we are talking about when we are talking about surgical management, we're talking about phlebotomy. So those are the ways that you can manage patients with varicose veins. As easy as that. Surely, if some of you were inside that hall, you would have grabbed the marks without any hesitation. Without any hesitation. Laser treatment and all of that. So that's it, right? So how can we prevent patients with varicose? How can we prevent it? You prevent it by watching your weight, eating high fiber food or less salt, because most hypertensive patients they are prone to that. Avoiding high heels and tight dresses on the legs. Elevating your legs when you sit, changing your sitting or standing position regularly. Those are ways to prevent varicosity. They are saying post-operative nursing care. What should I do? What are the various procedures I should do after an operation? When the operation has been carried out, a dressing also can be done, right? You can do dressing 24 hours after the procedure is done. Advised rest, right? Advised rest. You can administer medications as prescribed, right? You can also and you can also encourage, right? A lifting of the legs, just as we said, means of preventing it by lifting the legs when you sit. Encourage a lifting of the legs at the same posture that the person sits in, right? The legs be placed on the side table or something. Those are ways you can do. Elevate the legs when the patient is sitting in a sitting position. Keep the patient in a bed and elevate the legs. Right, that is what we are doing, so that blood should easily go down to the heart back. Blood from the vein should easily go back to the, because the purpose of that is because of the varicose vein occur because there is reduced blood flow back to the heart. And because of that, we want to do everything to do to retain it back. Even after the operation, we leave the legs or while the patient is sleeping. And when the patient sits, we also place the legs should be flat. We're saying we do dressing, we observe the incision constantly, right? For infections, you observe the incision constantly. Always observe so that there should be no infection. So that's all. I think if as soon as you have questions to ask me, there are many things to do. We are saying you leave the legs, do dressing after 24 hours, leave when the person is sitting, you place the legs at the same level of her piece or her posture of sitting. When the person is lying, you place the legs, check the wound, the incision site for infections, and do dressing. Administer drugs as prescribed. And all of that, try to identify the causes, things that led to that, and then educate the patient on the various diet. So that's what you should do, right? And most often at time, even after the patient is recovering, ambulation is good, but gradually, right? Gradually, not rigorously.